us about the correlation between diabetes and cardiovascular health? I mean, it's a big risk. I know as a diabetic, I know it's one of my biggest fears. I have to keep my HbA1c as low as I possibly can to avoid heart problems. So what is the correlation?
So, the correlation basically has to deal with, we know that high levels of sugar in the blood, high blood glucose, is directly damaging to the lining of the blood vessels. And we know that the higher your blood sugar is over the longer period of time, that is damaging to your blood vessels. There's a little bit of differentiation we have to make between type 1 diabetics and type 2 diabetics as well. Type 1 diabetics, the data is pretty clear that the better you control your blood sugar, and that's reflected by hemoglobin A1c, and the lower amounts of insulin that you can do that with, the lower the risk of heart disease, over the long term. In type 2 diabetics, we know that type 2 diabetes is very strongly associated with cardiovascular disease, with coronary artery disease specifically. So that is one of the major risk factors that we see for heart disease and for ending up with atherosclerotic heart disease. So if we can prevent type 2 diabetes by focusing on metabolic health, or we can reverse type 2 diabetes by focusing on metabolic health, we give those people a lot lower chance of developing heart disease, over their lifetimes. And we know that we can reverse type 2 diabetes by focusing on metabolic health. Virta Health has published their data, and they showed at 2 years on their program, which is, a dietary and lifestyle focused program that, improves all these markers of metabolic health. At 2 years on their program, 60% of their type 2 diabetics were off of medication and had a normal hemoglobin A1c. So, that's one of the other messages I try to get out to people, that type 2 diabetes is a reversible and a preventable condition. And if you're going to your doctor and all he's doing is, just putting you on more and more medication to try and better control your type 2 diabetes, that physician is not serving you well, because the goal of all physicians, if someone comes to them with type 2 diabetes, should be, we need to reverse this condition, we need to get you off of these medications, or we need to be able to manage it with the lowest amount of medication possible while still controlling your blood sugars. And
with
that's
no
what focus
insulin
on metabolic health does. Yeah.
For type 2 diabetics,
yeah,
no insulin. It is possible.
Conceptually, there's really no reason that a type 2 diabetic should be on insulin. Most type 2 diabetics actually have very high insulin levels. It's just that their body, because of their poor metabolic health, their body isn't responding to that insulin. So the concept that we should just give them more insulin really doesn't make a whole lot of sense. And what you really want to do with a type 2 diabetic is get their body to respond to the insulin again, and ultimately get their insulin levels down. And the way to do that is, by eliminating processed carbohydrates and focusing on the metabolic health.
Focusing on real foods.
Yes.